We knew early on that something wasn't right with Reed.
I remember staying up late at night and I did everything I could to try to figure it out.
The Cerebral Creatine Deficiency Syndrome are a collection of genetic conditions in which there is not a sufficient amount of creatine in the brain. As a result, the brain cannot function in the proper way. There are three known causes of cerebral creatine deficiency. Two are defects in the synthesis of creatine. The third condition is a defect in the transporter of creatine, the one that carries creatine inside the brain.
What they all have in common is that since creatine helps us to get energy to the right place at the right time in a cell, all of those patients suffer from a problem that is mainly affecting the functioning of the brain.
Probably about 18 months when he began developing seizures. We first noticed it too, but again, looking back, I think those seizures were happening earlier than we anticipated.
He had significant GI issues. He spit up a lot as a child.
Projectile vomiting, way beyond any normal reflux.
He was always under the growth chart as far as weight and height were concerned.
Sometimes there were trouble with initial feeding, such as latching right after birth when trying to breastfeed, sometimes a weak suck.
Typically, it's in the first 2 years that families recognize that the kids are not achieving all of the developmental skills as expected.
He wasn't crawling, he wasn't walking, he wasn't even attempting any of those.
These children usually are globally delayed.
Delayed language is often one of the things that parents and providers notice first as a problem.
She really didn't have any full words by the time she was 5 years old. That combined with absence seizures really started to kind of give us a heads up that something else might be wrong.
A patient has mild developmental delay and problems feeding. That is when you should start questioning if there are not other things going on that are actually uniting it.
One of the challenges to getting a diagnostic is this notion that there wasn't anything on fire. It's like being a detective and you're trying to latch on to what's that cue. And for creatine deficiency, it's very hard to find that. You don't have that big revealing sign.
As parents, we were desperate to find answers. We put him through so many tests and procedures. And at the end of the day, what diagnosed Reed was a simple urine test.
You can do a simple metabolite test. You send a portion of urine and a plasma sample, and then we measure for creatine and guanidinoate acetate concentrations. And this can lead to the diagnosis of GAMT deficiency, AGAT deficiency, or the creatine transporter. But of course, we also want to confirm that by genetic test and potentially also by an MRS.
Performing MR spectroscopy in conjunction with a magnetic resonance imaging examination of the brain, it provides 100% sensitivity for creatine deficiency syndromes.
Nothing was really specific until that MRS came back and it showed that lack of the creatine peak.
The ideal time to diagnose the creatine deficiency syndromes would obviously be newborn screen.
Well, for AGAT and GAMT, it's very important to diagnose immediately after birth, because when you start treatment early, you can prevent clinical symptoms.
If you don't start the treatment during this time, you may not be able to save some of the function that the brain is supposed to do.
Because of that early diagnosis, he's able to supplement appropriately and has hit all of his milestones with flying colors and is starting the first grade this fall.
Newborn screening of GAMT is so important because it is literally deciding if a person will have a life or not.
We encourage the medical community to screen for creatine deficiencies.
Screen creatine.
Screen creatine.
Screen creatine. Screen creatine.